Don't look at just Facebook or Twitter or whatever it might be. Really go for that highest level of quality of evidence if you really want to be safe and keep your family safe.
What can a healthcare advocate learn by becoming a patient facing a life and death situation? Why might a patient advocate write a book about his life-changing heart event? How does someone who has worked in the field of healthcare for 37 years see the field of healthcare changing to better suit the needs of patients? Welcome to Heart to Heart with Anna. I am Anna Jaworski. I am a heart mom. My son, Alexander, was born with a single ventricle heart in 1994, and he is the reason I am the host of your program. Many of you actually heard Alex interview me for our celebration of 300 episodes of Heart to Heart with Anna. Today's show is Tom Dahlborg, author and patient advocate, and our guest is Tom Dahlborg. Thomas Dahlborg is from Brockton, Massachusetts. He began his career in healthcare as a transport aide, IV aide, and housekeeper, where he saw firsthand the impact of relationships and connections within a healthcare system on clinicians and staff, and patients, families, and communities. He also has the experience of being a patient when he developed viral myocarditis and was told he would never work again and would need a transplant. Now, with 37 years of experience in healthcare service and leadership, Tom is passionate about improving the healthcare system and making healthcare better for employees to work, physicians to practice medicine, patients and families to receive care, and communities to thrive. Last year, he published his healthcare book, From Heart to Head and Back Again, a journey through the healthcare system. Today, Tom lives with his bride, Darlene, and their papillon, Gabrielle, in West Michigan. And together, they enjoy visiting their 3 children, Samantha, Tommy Jr., and Haley, in New England as often as possible. Welcome to Heart with Anna, Tom.
Oh, thank you, Anna. It's so wonderful to join you on your terrific show. Your episodes featuring Amy Lee, Lisa Koval, and her mom and daughter recently, and so many others are so engaging and so informative. And after each episode, the word that resonates for me is hope. And I think in this world, especially now, we all need hope. So thank you for all you do.
Oh, thank you for saying that. You are so right. Hope is one of the things that seems to be in short supply. And it seems like there's so many scare tactics when it comes to healthcare right now. So I think your book is extremely timely and so needed right now. I think there's a lot of misinformation in the healthcare world. And because of COVID-19, there's so much fear.
It's so true. And in fact, often you'll hear from leaders, be they healthcare leaders or other, that hope is not a strategy. That's the bumper sticker. But I've always saw it differently. I always saw it as, hope may not be the strategy. It's more important, though. It's the foundation for all. If you don't have hope, I don't care what your strategy is. You're not going to get there because you and or your team won't have any hope that they can get there. They won't go through that wall when you need to. They won't hold that hand when they need to because they don't have the hope. So, I agree with you, especially now. That aspect of hope is critical for all of us.
Well, it seems to me that whole aspect of hope was critically important when you were going through your own health journey. Why don't you take us back and talk to us about your early health journey?
So I know we're going to talk about my heart and how that links to my book. But before we get there, I'd like to talk about some of my other experiences in healthcare. So as you mentioned in that nice introduction, that I've worked in healthcare for 37 years, and I've worked on the front lines of healthcare, and I've had leadership roles. Adding to that, since I was very young, I also experienced the healthcare system in a number of acute ways. So as an example, when I was very, very young, I had challenges with my legs. So each night I would be strapped into metal braces, and those braces would be connected, and I would sleep that way or try to sleep that way. And that was a form of treatment. It was painful and it was unhelpful. And yet that was the standard of care at the time.
Did you have polio?
I did not have polio. I had some other issues with my legs that they thought, again, that this would be helpful for. In later years, I played football and I blew out my knee. And then I had surgery for that knee injury. That surgery I had back in 1984 is now considered malpractice. And that's exactly. And that surgery has led to an additional number of surgeries on my knees. And my bride tells me I've had 7. I think it's closer to 6, but either way, because predominantly of a bad event within the healthcare system, it's led to lots of pain, of course, lots of disruption in people's lives, and lots of wasted money and resource as they try to fix what they broke. And then
that's the number one thing is they're supposed to do no harm.
Exactly. And yet it's not necessarily the people, it's really the system that has led to a lot of this brokenness. I mean, the system is full of greatness and grandness, and it's also broken. I've seen amazing flames of goodness within the system. I've seen caring and brilliant and loving people, like my bride, of course, who were there to help, to make things better, to keep people, often who they barely know, safe. I've learned in each interaction, I continue to learn. And yet, what do we say in healthcare? And I know as someone like yourself, you hear this term often yourself. We talk about evidence-based medicine. And we talk about the science of healthcare. And yet, when we're providing healthcare, it is supposed to be about the science. It is supposed to be about the evidence. And yet, when you look at, say, Dr. John Ioannidis out of Stanford, what he's found in healthcare is that 80% of the non-randomized studies are wrong. And 25% of randomized studies are wrong. And yet that's the standard of care. That is still the evidence that we base all healthcare on. And then even going to the Institute of Medicine, they say in their commentary, half of all medicine, half of it is based on valid science. So I ask folks, really be aware of that, understand the research and the goodness of it and also the limitations, and be aware that half of what is being done may not have the science behind it. So we have to be extra vigilant and extra careful because of that limitation within evidence-based medicine so that we keep ourselves and we keep those we love and we keep everybody safe in healthcare and beyond.
Absolutely. One of the things that frustrates me as a heart mom and just a consumer of medicine is that it feels to me like there are doctors, the media, even friends who will cherry pick the science that they want to quote to you to make their point. And it's not like science is one big, obvious body of literature. There's so much literature, and it's hard to know what you can put your faith in. Don't you agree?
Oh, absolutely. And the research predominantly or usually is based on the average person and often is based on the average male. So now we're all different. We're all complex adaptive systems. We need to be sure that we understand those pieces of it. And those of us who work in healthcare need to understand, yes, we balance the evidence, we balance population health, and we customize, we individualize the actual care because that specific person is not an average person because none of us are. And we have to be careful.
Oh, and this is just so much more complicated for our kids who are born with funky hearts, because you can have 2 or 3 kids who were labeled with hypoplastic left heart syndrome or tetralogy of Fallot or any one of the 42 different heart defects, but they're not going to be exactly alike. Some of them will also have asthma. Some of them will have suffered a stroke. Some of them will not have anything else, only their heart defect. How do you compare across children who have such variances? To me, that's one of the great challenges of healthcare. But speaking of the heart, why don't you tell us about the serious heart ailment that affected your life?
I remember the emergency room, and I remember how cold it was. I remember the strange noises, and I remember the challenge to breathe, and I remember how lonely I was. This place was packed, and it was loud, and yet I was so lonely. And I remember at one point this physician pulls back the curtain and literally screams, "I know why you can't breathe. You have a broken nose." And then leaves, and I never see this person again.
What?
Now, I swear. And a note, I did not have a broken nose. I remember all the healthcare jargon that I didn't understand. And at that point, I was 15 years into my healthcare career.
Really?
I was married.
So it's not like you were a kid.
Exactly. And I was married to a nurse. And so I think about a child. I think about people who speak a second language or English as a second language. I think about older people, hard of hearing. So here I am, fairly healthy, except for, what was happening to me at that particular moment. And I was becoming anxious and scared because I didn't understand what was being said.
Sure.
On the flip side, I remember the transport aide, and I remember him calling me by my name, not by my diagnosis, not by the heart attack, which I was referred to a number of times as the heart attack.
Mm-hmm.
I remember him making eye contact. I remember him telling me how good the care team was up on the floor I was going to. And I remember him taking the time to introduce me to my nurse.
Oh, wow. What a sweetheart.
Exactly. And that's how caring should be every time, because it makes a difference.
Sure. Absolutely. If you can reduce a patient's anxiety, if you can make them feel a little bit calmer and like they're a real person and not just a number, it can make a huge difference.
Absolutely. And the evidence suggests that. It shows that. I also remember being in my room, and I remember the physical pain and the mental and emotional and spiritual pain I was going through. And one night in my hospital, my vitals were going crazy. And my nurse, she came and she sat on the edge of my bed, and she held my hand. And she said 4 magic words that made all the difference in the world. Holding my hand, she looked me in the eyes, and she simply said, "Tom, I've got you."
Home Tonight Forever by the Baby Blue Sound Collective.
I think what I love so much about this CD is that some of the songs were inspired by the patients.
Many listeners will understand many of the different songs and what they've been inspired by. Our new album will be available on iTunes, Amazon.com, Spotify.
I love the fact that the proceeds from this CD are actually going to help those with congenital heart defects.
Enjoy the music.
Home Tonight Forever.
This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The opinions expressed in the podcast are not those of Hearts Unite the Globe, but of the hosts and guests, and are intended to spark discussion about issues pertaining to congenital heart disease or bereavement.
You are listening to Heart with Anna. If you have a question or comment that you would like addressed on our show, please send an email to Anna Jaworski at anna@hearttoheartwithanna.com. That's anna@hearttoheartwithanna.com. Now, back to Heart with Anna.
Before the break, we were getting to know Tom, and we were learning about his health journey and 4 magic words. Tom, I've got you. Wow. I imagine in your book, From Heart to Head and Back Again, you talk about this. You talk about how that nurse made a difference in your life. Tell us more about your medical experience and why you felt the need to write a book.
I didn't really intend to write a book. My bride had been saying to me for years, "You need to write this. You need to share your message. You need to tell people." I always felt I'm not good enough, and people have other issues, and they've been through more. And yet my bride is wicked smart. And I said, okay. And so we strategized, and we said, okay, we're going to create a path forward for me to devote my time and energy to write the book. My intention came down to understanding. I wanted to help people understand such things as the level of challenge for patients and families to navigate the complexities of the healthcare system. As we talked about earlier, and I know you as a mom of a child who's been through so much, the complexity, especially for any of us, but especially for folks who don't know the system, don't know the funding, don't know the drivers of why decisions are made. It's incredible, and it's scary, and it leads to adverse outcomes if you don't understand. So I wanted them to be aware that they need to listen, and not just listen to respond. And we're wired to do that, and we check a box. Yeah, I listened. But to really understand and do so, all people who are engaging in the healthcare system, from the doctors and nurses, the frontline team, to also the patients and families, of course, and the community, to really listen and to the best of our ability to see through others' lenses. We can't put ourselves in their place. We try to, but to the best of our ability, try to empathize and understand and be aware. And that leads into another aspect. I wanted people to understand the importance for healthcare leaders to create care models, which is not only about the financial drivers of healthcare, but to ensure the development and sharing of relationship and trust and connection and empathy and compassion. Quite frankly, love, and how important love is within a health caring system so that we get the best outcomes, because we'll do whatever it takes to get those outcomes, regardless of funding, because we love that person that's sitting before us or laying before us and their family.
Don't you feel that's been especially difficult the last 18 to 24 months with COVID? It seems like there's so much fear surrounding COVID that you get the impression that everybody wants to hold everyone else at arm's length.
I do. And on top of that, you have many, many, many healthcare workers, those frontline folks especially, that have been working inordinate amount of shifts, that have been scared, especially when there was less known about the virus. Now, we're still learning, but even when it was less known, and that fear, and then, of course, the deaths of the people working in healthcare, in addition to, of course, the patients themselves, you can understand why maybe people would do that. And yet, within the healthcare system, we have to find ways to still embrace people, to still have connection, to share love. And it may not be that physical touch, or at least not as much. We need to do it safely, and yet we still must do it. And we need innovative, creative thinkers to ensure that that's still happening, because too many people were dying alone.
Yes, I had a good friend who died alone in a hospital. It broke my heart.
Absolutely. And I also had a good friend whose young wife, and they have a young daughter, died alone.
It's just tragic.
It is. So it's not that we have bad people making bad decisions. We have really good people trying really, really hard to make good and challenging, tough decisions. Again, going back to the evidence, half of it's wrong. And we still have to go to the best evidence we have at any given time and treat people the best we can, and ensure love is part of that medicine that we're sharing.
I feel like love was one of the missing ingredients for how people were treated, not only in healthcare, in education, even when it comes to shopping and just being out amongst other people. I felt there was such a wall of protectiveness built around every person that the love wasn't even able to eke through. And that is so tragic. How many people died in the last 18 to 24 months who felt alone?
Exactly. If I remember correctly, and please don't hold me to the specific numbers, but loneliness is as dangerous as, and there was a study around this, 15 cigarettes a day or something like that.
Wow.
We don't understand the unintended consequences of pandemic risk mitigation. There are unintended consequences. So what we need to be doing is really thinking about, yes, we're going to keep people safe, and here are the decisions we're going to make around that. We're using research, and we're using evidence, and we're using quality improvement principles. And we need a measurement strategy that understands those unintended consequences. When you think about the level and increase of anxiety, depression, suicide in children right now, because a lot of it linking to the decisions we made to keep people safe.
It's ironic.
Absolutely. And again, it's not bad people. We need additional lenses. We need people at the table, not just infectious disease physicians who are brilliant and incredibly important. We need the mental health and the child psychiatrists, and all these folks at the table together making those decisions.
Absolutely. I agree 100% with you. Wow. You just covered so much important information. It's hard to know where to go from there. It seems like your book is not just for the congenital heart defect community, but for everyone.
That was the intention. The book is set up where it's a story. And within the story, at the end of each chapter, it's the marriage of the story, that heart challenge. Me as a patient sharing at the end of each chapter is me as a healthcare leader reflecting back on lessons learned or opportunities or, again, goodness, flames of good that we need to continue to fan. So it's all of that. It is for all patients, all physicians and nurses. So the book is being used in hospitals, as an example, as part of nurse executive councils to help nurse leaders understand the impact of decisions and of the model and of what's happening in the market. So yes, it's about the heart in lots of different ways, including the love that comes from our heart. And it's about a lot more.
When I was looking at the transcript for one of the podcasts where you were a guest, you were talking about the importance of not incentivizing people to care. And as a former special education teacher, that really hit home to me because I grew up where people would talk about incentivizing teachers to care. You can't incentivize somebody to care. Either people care or they don't care, in my opinion. Really, service-related fields tend to attract people who care about. For me, it was education. For your wife and my husband, it's nursing. But talk to me about your experience as a healthcare leader and that practice of trying to incentivize care.
So first, Anna, you're spot on. You can't incentivize people to care. And in fact, the Harvard Business Review has been very clear as to the adverse impact of financial incentives in general, and specifically within healthcare. And yet, we try to do it all the time, including I tried to do it. I remember years and years ago, learning how healthcare is financed. And I learned how, based on how my organization paid physicians and health systems and so forth, that was how care was going to be delivered. And it was how we were, again, based on how we were paying. And so more and more, the incentive became about maximizing revenue. Hopefully for good reasons like keeping the doors open so you can care for more people.
Sure.
But not always.
Mm-hmm.
I remember I was talking to this physician, and she was running quality counts in Maine. It was this organization all about, again, quality in healthcare. And we were talking about what needed to be done, what was going to be best for patients in the state of Maine. And she looked at me and she said, but we can't do that until the funding or the financing changes. This is a caring, loving, wonderful person. And we had this legitimate disagreement because, just like you said, we need to hire people for compassion, caring, skill, integrity, and more, because we need to do what's right for patients regardless of the financing, regardless of the funding. We need to fix that. And again, I wore a CFO hat. I was negotiating with hospitals. I was on the wrong side of the table. I was thinking that, yes, I can make things better by putting more money on the table. And as Harvard Business Review noted, no, it actually makes things worse, because what it does is it takes the care and the love out of our system. And what used to be that intrinsic, I'm in the system because I want to help, becomes that extrinsic motivator. You're looking for that extrinsic motivation to do the right thing. And it just doesn't work. And like I said, it does harm. So nowadays, we've gone from fee-for-service to pay-for-performance to capitation to case rates to per diems. Now we're in this value-based reimbursement era where, again, we're incentivizing right behavior. And again, the financing needs to be aligned. I get it. Again, I lived in the finance space. And yet we need to focus more so on what's best for the patient, what's best for the community, what's best for the team, and make our decisions based on those things. If the financing doesn't align 100%, so be it. Let's fix it on the back end, but let's keep doing the right thing always.
Anna Jaworski has written several books to empower the congenital heart defect, or CHD, community. These books can be found at Amazon.com or at her website, www.babyheartspress.com. Her bestseller is The Heart of a Mother, an anthology of stories written by women for women in the CHD community. Anna's other books, My Brother Needs an Operation, The Heart of a Father, and Hypoplastic Left Heart Syndrome, a handbook for parents, will help you understand that you are not alone. Visit babyheartspress.com to find out more.
Heart to Heart with Anna is a presentation of Hearts Unite the Globe and is part of the Hug Podcast Network. Hearts Unite the Globe is a non-profit organization devoted to providing resources to the congenital heart defect community to uplift, empower, and enrich the lives of our community members. If you would like access to free resources pertaining to the CHD community, please visit our website at www.congenitalheartdefects.com for information about CHD, the hospitals that treat children with CHD, summer camps for CHD survivors, and much, much more.
Before the break, Tom, you were talking to me a little bit about your book, but in this segment, I'd really like to talk about the future of healthcare. And we already started talking about that in the second segment. Let's talk about this caring. And you were talking about how we cannot incentivize caring. What about bullying? It seems like there's a lot of bullying, which is the opposite side of that caring coin. What can we do to minimize the bullying that we see that's happening in our health community?
First, it hits very close to home for me and my family. You see, my son was bullied from a very early age. And in fact, he was bullied predominantly by adults. At that time, we thought we must be the worst parents ever. How could our beautiful child be being bullied by adults? And it was when I was working for the National Institute for Children's Health Quality, and I listened to a number of experts in this space, and they said, no, it's actually the norm. It's actually more the norm than one would think, that children being bullied by adults. Now, my son, he was born with a number of neurological challenges and was a big kid, and he was bullied for both. The bullying for my son was so bad that by the 4th grade, it's always hard for me to say this, my son put a belt around his neck because, as he later noted, thank God later, the pain was so great.
Oh my goodness.
Yeah. Now, my bride and I didn't know this. We learned this when my son was 23.
Wow. He kept it to himself for that long.
He did. He did. And it was actually just a couple of years ago, he's 25 now, that he came out on the deck and we were enjoying a nice evening. He says, Mom, Dad, I need to tell you. And then he told us what was going on.
Wow.
Now, I wrote a book about bullying in children. I was being asked to speak about bullying. And here I am not realizing the pain bullying did or the harm bullying did to my own son. So
I don't think that's uncommon, though. I was bullied as a child. I had the opposite problem your son did. I was always the littlest kid in the class, and I was bullied a lot as a kid, and I do not remember going home and telling my parents about it. It was one of those things that I think there's a lot of shame that comes with being bullied, and you don't want to talk about it.
Yeah, you're right. Another example, here's my oldest daughter, who's 27, and she was Miss Maine USA. She competed in the Miss USA pageant. She was on national TV. We found out again later on that when she was in high school, she was bullied so bad, she used to eat her lunch in the bathroom every day.
Oh, you see that with kids that you think, oh, of course, they're the most popular ones, but they're not.
Exactly. And one of the messages I've learned, and I try to share with others, is that, like you said, it's not, oh, they're not going to be bullied, that person will be. No, it's any and all of us need kindness and love always.
Mm-hmm. Yeah, I agree.
But why do people bully? There's lots of research on it. And some people bully because they've had traumatic situations when they were growing up.
The things that's really frustrating to me right now, because I am one of those people who just wants to tell everyone, just be nice. I hate the mask shaming and how people will give you dirty looks if you're not wearing a mask. I live in Texas right now. Mm-hmm. We have had the mask mandate lifted for quite a while, actually. Governor Abbott was one of the first, I believe, to lift that mask mandate. And so he did leave it up to each individual store owner whether or not they wanted to require people to wear masks. But there was a lot of mask shaming going on here in the state of Texas, and I'm sure we're not the only ones. Why is it people are so up in arms? I know that there are people dying, but my husband is a nurse, and he actually read a study where they tested the masks of children who had been wearing their mask in school for 6 to 8 hours. And they took those masks and one child's T-shirt and the teacher's mask, and they cultured it. And oh my goodness, Tom, there were all kinds of diseases, illnesses, viruses in those masks that those children and that adult were breathing in over and over for 6 to 8 hours.
Right.
It's not necessarily a good thing to wear those masks.
And what I've witnessed is most people who even are wearing masks, and those same people who are shaming other people for not wearing masks, are not wearing masks appropriately. Therefore, they're putting themselves in harm's way and they're putting others in harm's way. So even if you believe that the masks, everyone should be wearing them and so forth, it only works if you're doing it the right way.
Sure.
And most people aren't.
Right.
And
I can't tell you how many people I have seen, Tom, who are wearing a mask under their nose. And I get it. It's hot. I wear glasses. Some of those masks do not form a nice seal, so your glasses end up fogging, and it's easy to run into things or not be able to see things properly. They become more of a nuisance than they do a help. So I understand why they might be wearing them below their nose, but if they're wearing them below their nose, Tom, that's not doing what they're supposed to be doing.
Exactly. And it's giving a false sense of security, which leads to even more harm. And even if they're wearing it over their nose, it's when you touch that front of it with your hands to move it, to adjust it, and then you may take it off to eat or drink, and then you put it back on. All you're doing is putting more germs back up into your face.
Exactly.
And so again, CDC is very clear on how you should be cleansing your hands between every time you touch your mask, how you should only be touching that mask back by the ear and all these other pieces. So, yeah.
Is it even realistic?
That's just it. People do it in the hospitals. So I've seen it work. I've seen people do it the right way. Most people I know don't do it the right way. So hopefully, it's a great question. Is it realistic?
Well, we need people to be vaccinated. And then, oh my goodness, there's so much shaming when it comes to the vaccination. You have this whole population that feels that the vaccine is bad, is evil. And then there, of course, is another big percentage of the population that feels that the vaccine is a savior, is something that we should be celebrating, especially when you consider how quickly this came together and how I honestly believe it has saved lives.
Clearly it has. And what's interesting to me, be it the mask or the vaccine, how often do we hear people say, but that's what the experts say?
Yes.
Let's assume that the expert is truly an expert as opposed to something else. When we think about the hierarchy of the quality of evidence and also the hierarchy of the risk of bias, the bottom rung, the worst evidence is expert opinion. The expert opinion has the lowest quality of evidence and the highest risk of bias. It's not until you have the systematic reviews of meta-analysis of random controlled trials and so forth. That's the best. That's the gold standard or the platinum standard. What is that highest level of quality that has the least amount of bias, be it financial bias or human bias or whatever bias there is? So I'll go out to the Mayo Clinic. I'll go out to the CDC. I go to the WHO. I'm looking for, okay, what's the latest evidence? What's happening now? Because things are changing.
Sure.
I would suggest to everybody, do the same. Don't look at just Facebook or Twitter or whatever it might be. Really go for that highest level of quality of evidence if you really want to be safe and keep your family safe. If you just want to have an opinion and share that opinion and feel good about it, God bless you, do what you're going to do. But if you want to actually try to help people and keep people safe and quite frankly, love one another, then you would go for the highest quality of evidence with the least amount of bias.
I think that's absolutely true. And if we're talking about loving one another and compassion, which I believe is the crux of your book, then I think what we need to do is practice compassion always and stop the shaming, stop the bullying, and recognize that if you're afraid of this virus and you feel that other people are being unsafe with their practices, then stay home. We're lucky that we live in a day and age where you can have your groceries delivered. You can watch your church service on your computer or on your television. You can talk to people with Skype or WhatsApp or Facebook. You have so many different options where you can stay safe in your own home and not risk yourself without going out and being unhappy and making other people unhappy with your bullying and shaming.
Yes, bullying and shaming harms always. In healthcare, how often do we shame and bully patients?
Oh, yeah.
It doesn't lead to the right results. That is because of lots of reasons, including we're human. And we're stressed, we're burnt out, we're frustrated in so many ways, and we express ourselves in a lot of not necessarily the most healthy ways for ourselves or for others. And it needs to change. Here's one of the, I hate to put it this way, but it's a silver lining from the pandemic. There are so many innovative ways that people, like you said, are able to now connect with one another, that we can connect with our physician through telehealth. We can get the groceries and not have to go out, especially if an elderly person or someone who's injured or sick and afraid. And so if they don't have to. So there are some silver linings and all that. When we think about technology, we have to be very, very careful. We don't let that pendulum swing so far that technology becomes the solution. Technology needs to be a tool that allows us to connect, that allows us to develop relationship and trust and love, that allows us to be together even if we can't necessarily do so. When it becomes the solution as opposed to that tool for that connection, then we start to get in harm's way again. then we start to hurt people again. And going back to that piece we said about loneliness and so forth.
Sure.
Technology is wonderful. Appropriate human touch is incredibly important. Dr. Verghese is also at Stanford. I mentioned Dr. Ioannidis is also there. And he talks about the eye patient, and he cautions us. When we think about like iPhones and so forth, he cautions us that with technology, we don't allow the eye patient, that patient that's in the chart or on the laptop or on the iPad or whatever, become more important than that human being that's standing right in front of us or sitting right in front of us. And I just think that's such an important message, and it's so relatable. And it's just something that I know I hold close to my heart, that I don't allow technology to overrule humanity.
I love it. Wow. You've given us so many things to think about, Tom. Tell everybody how they can get your book. I'm sure there are a lot of people who will be interested in it now that they've heard you speak.
The book is From Heart to Head and Back, A Journey Through the Healthcare System. You can get it on Amazon, or you can go to health-caring.org.
Great. And we'll have links in the show notes. So any of you who are exercising, driving, you don't have to worry about taking notes. I want you to focus on what it is that you're doing. But you can always look in the show notes. And that's the description of the show. And there will be a link right there to take you to Tom's book. Tom, thank you so much for coming on the program today. I really enjoyed our conversation.
Well, same here. And again, when you invited me on, I felt so blessed and honored, because the people you have on, they're incredible. They're passionate, they're wise, and they share wisdom and they share hope, as do you. So thank you so very much.
Thank you. I love how my guests are really passionate people, and they're so smart. I love surrounding myself with people who are really smart and creative. So that does conclude this episode of Heart to Heart with Anna. Thanks for listening today, my friends. Please come back next week on Tuesday at noon Eastern Time for a brand new episode. Until then, please find me on Facebook. Just look up Heart to Heart with Anna and let me know about your favorite CHD book and why that's your favorite. I'll share some of your responses in future shows. Until next time, remember, my friends, you are not alone.
Thank you again for joining us this week. We hope you have been inspired and empowered to become an advocate for the congenital heart defect community. Heart to Heart with Anna, with your host Anna Jaworski, can be heard every Tuesday at 12 noon Eastern Time.